Are you building a business, feeling the stress of all the pressures on you, and hungry to learn from other entrepreneurs? Then you're in the right place. You're listening to But First Principles, where we highlight the principles you need to win both at work and at life. Let's dive in. All right. Well, I'm really happy. In fact, I'm laughing right now. We're just cracking jokes a little bit. I'm here with Lucian Roberts of Infusion Solutions, and another gentleman who's been around for a while and done a lot of business. And I love what he's doing. I love the business model, and the way he puts it is he's a kumbaya kind of guy. So really focused on what I'd say first principles. Serving your customer, that kind of thing. We'll get into that. So. Lucian, just want to give you a chance to give, a little bit of your background, kind of a nutshell version of your history, how you got to where you are, what you're doing.
Super. Good to be here today. I'm Lucian. I co-founded a Richmond-based company called Infusion Solutions 4 years ago. And before that, I ran medical practices for most of my career in Richmond. And um, then COVID came. We were all ready. Well, COVID caught me right before the infusions came out, or the vaccination. So I ended up with COVID, spent a day looking at Chuck Norris movies, thought, damn, this is the life. Felt guilty the next day, worked like a dog from home for 2 weeks, got back to work, felt really guilty, ended up with pneumonia,
Hmm.
worked through that, and I ended up with long COVID. So, and over the course of the next year, I'd stopped smelling. I had leg cramps keep me up at night, and there are times where I'm just dumb,
Yeah.
just dumb. So I retired from,
Is that a technical medical term?
that's a
It's
technical term.
yeah.
Half the world is smarter than the other half, and I was in the bottom quartile, and I still am some days. But that's been part of my journey, and we had started Infusion Solutions while I was still working full time. And for the past couple of years, that's been my happy spot. So that's what we do. We spread happiness one patient at a time.
That's
Kumbaya.
awesome. Kumbaya.
Kumbaya.
And what so you mentioned your full-time job or your previous occupation really. What's some of your work background?
I have a master's in health administration from MCV, VCU, and actually met my wife of 35 years there. She was the classmate, and we have a couple of kids. And uh, after our first kid, we decided that rather than me be a hospital administrator and move across the country, that we would do a shift and that I would focus on managing practices, leading practices, and then
So
call Richmond
small,
home.
like general practitioners kind of thing when you say medical
Um,
practices?
Neurology,
Okay.
neuropsychology,
Specialists.
gastroenterology,
Okay.
private practice. More and more of the practices are owned by private equity or hospitals, but I stayed in the private practice realm during my whole career.
Gotcha. Okay. And what was your role, especially in terms of the business side of that, right? What was your role in the private practices?
Um, I'm I guess, the leader and the sort of the glue. Doctors do doctors, and you have your staff. And while there's some overlap, the doctors tend to know a couple of folks in their office and not the entire infrastructure.
Sure. Yeah,
So
absolutely.
sometimes you're a buffer, sometimes you're a cheerleader, but a big part of that role is to uh, keep the eyes on the ball. Why are we here? And then to make sure your employees are heard. Because, turnover is prevalent in healthcare like everywhere else. So you want to let folks know that they are appreciated and trusted and needed. And even somebody that isn't patient facing makes a huge difference. The first person that answers the phone that that patient may never see may be the most important person they talk to. They're the ones that are going to say, You're in the right place. We're going to take care of you. That's huge. So just
Yeah,
making
yeah,
sure that all
absolutely.
those dots are connected.
Yeah. That's awesome. And so, you're kind of quarterback with, the different
Mhm.
functions within the business. And was your role technically CEO?
Yeah, it's chief administrator, I think was my title. I'm
Okay.
not much of a title guy, but I think that's
Yeah,
what it
sure.
was.
Within that industry, there's different terminology and
Yeah.
yeah.
Yeah. You're
So,
the non-physician leader of the practice.
yeah. And in fact, small aside, my dad was a doctor, is a doctor. He's still practicing, and went to Yale. He's a very smart guy. Started his own practice, right? And not with private equity or anything, just his own bootstrapping. And turns out he wasn't. And my dad knows I tell this story. He was great. He is a great doctor, not a good businessman, right? So we went bankrupt when I was 13 and moved out of California. I grew up, on the lake in this really nice area, kind of resort town in California, near outside of LA. And we moved to upstate New York because my dad got a job offer out there. And it was really hard time for my family, and he rebuilt and now he's very successful, but he had to learn to stop being a doctor and start being a businessman, right? Or
You have to, and leading a practice is you can't dial it in. It's 24/7, 365. You know, it's the schedules, it's the snow, it's every facet of it if you have employees that are having a tough time. So it's fulfilling, but it wears you out. And I think that it's become a bit of a hamster wheel. You know, it's a young person's game now to have that energy to do it well and do it right. And looking back, I would have had a better work-life balance. But it took long COVID to help me figure that out.
I mean, it often does. It often takes something that knocks us off our feet,
Absolutely. Let me quickly tell you about how Infusion Solutions came to
Sure,
be.
yeah, absolutely. Yeah, yeah, please.
So I have a wonderful partner, Annette Bennett, who lost her brother to colon cancer right before COVID, actually. And he would get treated, get infusions in the traditional infusion center. It's a big sick bay with shower curtains between
Oh yeah.
people and a stainless steel tray. And at the same time, my dad, who also was a doctor, who wanted to live forever because he thought mom needed her to live forever. He lived about 5 years past his sell-by date. And we can keep you alive. We strip away your dignity. We stripped away his dignity.
Yeah, yeah, yeah.
So he would go over to the hospital down in South Boston and get an infusion. And I would go to Walmart when I went down there on weekends, pick up some blankets because a 93-year-old guy who isn't moving, and is 93 is always cold. And then you put fluids inside of them and they're really, really cold. So,
Hmm.
if I wanted to sit, I'd hopefully find a folding metal chair. One day I didn't find it. I didn't sit on the floor. I sat on the arm of his infusion chair. And I was like, damn, that's cold. So we're putting all these blankets on dad, and the medical grade vinyl underneath him is freezing.
Yeah.
So I had this epiphany, hey, infusion patients sort of get heated chairs, and I ought to have a place to sit in as a family member that's more than the floor or a fold metal chair.
Right.
That is Annette and our friends, and with that simple vision, private rooms, heated chairs, comfortable seating for loved ones, and let's let nurses do what they're supposed to do. Take care of people, nurse them. Um, we built a business.
Wow. Yeah, I mean, and it's kind of classic. I mean, there's a market, there's a need or there's a, possibility for serving them better that's not being met, there's a gap. And all right, that's where the business, is going to focus.
Yeah, and let's dare to be different.
Right.
So most infusion centers are part of a physician's practice. Um, and the patients come from the practice itself, sort of a
Yep.
shooting fish in the barrel thing.
Yep.
We saw you, you're going to get your infusion here, and we are agnostic in that regard. We set it up um, with a business model of taking care of patients one at a time and a slow growth built on word of mouth and wow service, legendary service. So
Mhm.
our differentiator we knew going in was going to be those things I mentioned, and then to be able to deliver on them. Blah, blah, blah. I can't say deliver today. So to deliver on them one patient at a time, time after time after time.
So, I, if you don't mind me asking a couple questions about sort of like financial,
Sure.
sort of from a financial angle on that. Um, and in fact, I kind of the way that I think about business is in terms of business model, sales and marketing, operations, finance and legal, leadership, and then continual improvement, like new things you're going to try, right? So sort of like an overall framework that I use.
Hmm.
Um, and so financial is each of those pieces is essential. Sales and marketing operations, like how you deliver your service, and then financial. Um, and a business owner needs to be able to do all those things, like get
True.
clear about the business model, lead, have a vision, have that's the leadership part, do sales and marketing, do operation, make sure at least make sure it's working, right? So with that very long preface, um, the the slow growth model, word of mouth and kind of white glove service, um, that's really challenging if there's not much of a margin. Um, and it sounds like you're trying to serve people who might not have a lot of is this I guess what I'm really getting at, here's a simple way of asking, is this a premium service, or is this something that you can work with insurance with, or how'd you figure out the pricing model?
The insurance companies figure it out for you.
Yeah. Okay.
This is healthcare, man.
Yeah. Okay. Fair
Um,
enough. You can't. Yeah. It's not like yeah.
so I went to the medical group that I managed and said, "Hey, had this epiphany, sat on the arm of a chair. This is what we got to do, but we're going to do it different." And the model that I shared is not the most profitable model.
Right. If
You
it's
know,
fixed. Yeah. Right. A
it
fixed
isn't.
income.
And Annette and I talk with other companies who are infusion services that traditionally work in doctor's offices.
Mhm.
They do the billing, they procure the medications, the infusions, and we partnered with a company called Helix out of Houston, Texas. That's a critical part of the story. There's a medication called Tepezza, for instance, that is for thyroid eye disease. You see a lot of commercials on TV for it. It's 8 infusions. Those 8 infusions, the cost of the drug is between 450 and $500,000 for one patient.
Oof.
And when you're paying at 60 days and the insurance company may not pay for 90, we didn't have that sort of float. So we found a partner in Helix who believed in this agnostic setting, this kumbaya sort of thing, and they provide the float for it. Um, we
Wow.
we do some things at a loss, and we know that, but that's for the community. So I have negotiated with some of the insurance companies to cut the loss, to reduce our spend. And we have gotten a little bit better reimbursement on a few of the medications, which allows us to provide this community service as well. Um, we aren't in it to, it's not, profit isn't our primary motive here. It's making a difference in the community. And I'm at a point in my career at 62 where I can do that. So that's what I choose to do.
Yeah. Yeah. I mean, so again, not to um to get a little bit in that financial question because that's
Yeah,
like a business makes a profit, right?
absolutely.
And I really want to talk about more of the kumbaya stuff. We're serving people really well, but I also want to establish a firm foundation. This is a business, and there are certain things you have to be able to do if you're going to be a business. So. Did you have to take out a loan to start it? Was it just your own personal, like, did you find any kind of investor or, um, you
We
know,
put our own seed money, we put our own seed money into this. And that was the basis for it. We borrowed money for construction,
okay. So you did, yeah, your own
and
facility. All right.
then when the we built out a second suite right when the COVID treatments came out, the Regeneron and so forth, because um, it was the right thing to do. And we ended up, our piddly little place ended up taking care of more COVID patients, saving more lives, keeping more people out of the hospital than anybody in the entire Commonwealth, and
Wow.
more than all the Richmond area hospitals combined.
Was
Um,
that because it was brand new? So you
the
could just
hos
do,
People were going to the hospital to die. 3,800 Americans were dying a day, and the hospitals, the way the federal government had the drug, they gave it to the states. The states gave it to the hospitals. So, called the state COVID czar who controlled the supply and said, "Hey, Dr. Awesome, you don't know me, but I'm Lucian. We got this infusion center. Let's save some lives together." And he said, "Okay." And I said, "Oh shit." I didn't think he was going to say yes.
yeah, exactly. I thought this was going to be a negotiation.
Yeah, I
Yeah,
just
right.
thought it was a feel good call. Yeah, he'd say no, but I tried. And
Oh no.
oh no is right. We had a contractor friend who built out a suite with extra air turns and so forth, and then have a staff that believe in it. And so one patient at a time, we changed the trajectory of lives.
Yeah. Yeah.
That that is something where you do something not for the money, but it turns out to be a tremendous investment. You
For
can't
reputation and the people that you are
exactly,
you get
exactly.
connected with and yeah.
If you save somebody's life or keep them out of the hospital, you're not just impacting their life, you're impacting family and friends.
Yeah.
And
Yeah.
so
Yeah.
those are opportunities that while they may not show up on the bottom line as beautiful, beautiful profit, they are every bit as important to the story of a small company as anything else.
Yeah, absolutely. Well, okay. I really want to get to the more, like people first kind of conversation. One last sort of hard-nosed question. So
Yes. Okay.
how do you stay on? Because and I in fact uh I well for
We
NDA
make
purposes I won't.
We're
What's that?
profitable. We're
Yeah.
profitable.
Okay.
And we are profitable. We
And how hard do you have to do you have to work to make sure like to balance to really work the numbers to make that work? Or is it fairly does it work
it
fairly
it
well?
our model would not work without having a partner like Helix that provides the float.
Yeah. Okay.
If
Gotcha.
you've got that sort of spend in drugs just on one patient, the math doesn't work for
Right.
we're net not to do this as solo entrepreneurs.
Yep.
So we give up some of the profit margin to them, and it's a really good trade-off.
Nice.
We could make more now. We could make more if we cut some corners.
Right.
Um, we built a small business where, and I think with a lot of entrepreneurs, they want to get to that point where they can sell it to private equity and at multiples. That's been there and continues to be there. I bet I got 10 emails before our call today, um, just asking to sell, and it's all a variant of the same thing. So the big payout, if you will, is there anytime we want to flip the toggle switch.
So it works. It really does. As a business, it works well. But and now, like, I'd love to hear the ways that you're really focused on serving people and really focused on.
So yeah,
Yeah.
we make a profit. We could make a lot more if we did it differently. If we hadn't uh, an efficient model that didn't have high rent costs, that didn't have as good a nurse patient ratio. But that's not what we choose to do.
Yeah.
Um, and I could increase our margins 5, maybe 10% pretty quickly.
Mhm.
Um, but that's not our commitment.
Yeah. Well, that's one of the reasons I want to talk to you. I mean, principles, right? I mean, it is a matter of balancing principles, and really, some are way more than others. Some are more important than others, and yes, you have to make profit as a business. Otherwise, you're a charity, right?
Yeah.
But like, you really want to serve people, and you want, and like that. I love that image of you sitting on the the handle of, or what is it, the the arm
Arm.
of the chair, right? And it was cold, and just we could really kind of pamper patients, as it were. So I'd love to hear you talk more about that. How is it that you really are, maybe some stories even of ways that you really create a great experience for your patients?
Okay. Um, I thought this podcast was about principles, like high school principles and so forth. So I'm glad we're talking about principles.
Oh, yeah, 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 yeah.
I've
Right.
been
Well,
going
you
the
can tell
wrong
stories about your
direction.
principles if you want. I mean, that's not really where I want to go, but
Sorry about that, Mr. Clark. I didn't mean to badmouth you there.
yeah,
Um, I think there are a couple of things, and I will indirectly answer your question.
sure,
I
absolutely.
know I know my market well.
Hmm.
I know my competitors, some of them better than they know themselves. And I think when you're an entrepreneur and you have an idea, um, there are a lot of amazing ideas that get thrown out every day. You need to understand how yours fits in your marketplace. You
Hmm.
know, how do you differentiate it?
Yeah.
And when you have differentiators, you want to be pretty crystal clear about them.
Hmm.
Um, because there are a lot of folks that, infusion is a commodity.
Yeah.
Healthcare is a commodity.
Right.
Podcasts are commodities. Any of these things, we're looking to differentiate ourselves. And um, I I know what my competitors are doing, but I also am open to them knowing what we're doing. Does that increase competition? Yeah, but that's going to improve the level of care in the community.
Hmm.
You want to see what we're doing different? This is it.
Oh man. Yeah,
Um,
that's good. I embracing competition, I think, is really important.
yeah, yeah, absolutely. It's going to raise all ships or whatever they say. Um, Listen to your staff, listen to your team, and not lip service, but you've got employees, and the most important things you can tell anybody that you work with is, I believe in you, I got your back, trust you, and I love you, you know. So letting them, though they aren't owners, to have some ownership of the direction of the company is critical. They aren't widgets, they're your people. They're part of your dream, and you need to make this dream part of their dream.
Yeah, that's part of
So,
casting the vision, right? As in leadership and
yeah, so a lot
bringing
of
them.
the ideas that I've gotten have come from uh, just talking to my team.
Hmm.
And incidentally, we don't use LinkedIn or Indeed or anything to get people. Our employees tell their friends, hey, get off the hamster wheel, come over here with us. So my employees actually are my recruitment team. It's beautiful.
Yeah.
And then the other piece of that is listening to your customers. In my instance, that is the patients and their families. So, two examples, these heated chairs that we have, heated infusion chairs, um, they have a little desk, mini desk that fold in, and they come with a IV pole that's attached. Well, if you have a 4 or 6 hour infusion, you can't do it with my bladder. You gotta go to the bathroom. So the way, what it
Yeah,
was you had to
yeah.
get a nurse to unhook them and the patient go and then hook them back. And one of the
Yeah, like it's a very
patients,
sterile environment usually, and it's like, you're
yeah,
just
put on gloves, and if
right.
you look at it from a cost standpoint, that's time and then it's the cost of the gloves and rehooking because you want to have it sterile. But I had a patient who said, why don't you get a separate freestanding IV pole so that I can go to the bathroom by myself? Great idea.
Right.
Great idea. So we have that. I have another patient who was working to conserve her PTO, and she said that the little fold-in arm desk, were too small for a laptop. And she came in with a beautiful lap board. It was cool that she'd gotten off of Amazon, and she worked on that. And then she had her drink and her snacks on the two little tables. So I took a picture of it, said, Danielle, can I take a picture of this? And we had two the next day from Amazon. So listening to your customers. And then if you think you got it figured out, ask them, all right, what can we do better? What can I do to wow you and your family? Also ask the family members. So that's what, I encourage folks to do. It's know what your competition's doing, but encourage healthy competition. And then ask your employees and your patients again and again and again and again. All right, we're doing well. What can we do better? Let's not rest on our laurels. Let's raise the bar a little bit more.
Mm. Ah, that's great. Um, yeah, and in fact, I have had some experience working in hospitals and just a little bit, and I've known a lot of nurses, and um, the accounts that I've heard and some of the things that I've seen is that it's really easy for doctors and nurses to really forget the human element, to forget to really listen. You're just trying to get an agenda and just get through as many as possible, right? You're trying to get an agenda across. You're just trying to, get the patient to do this thing, right? And I love that you've stayed so grounded in that reality of like, listen. I mean, that's listening is one of the most powerful things in human relationships, in human life, and that's I think that's what makes what you were just talking about, listening to your customers, listening to your employees, looking for ways to improve things. That's
But
even
it,
the kind of
yeah, but I've made mistakes and I've learned by stubbing my toes like everybody else.
sure,
And
sure.
it was long COVID really that got me off the hamster wheel of
Mm.
doing healthcare. As you know, it's just
Yeah, grind it out or
it's a grind. And for a few months I was really pissed off from my long COVID. I was pissed off that I couldn't smell and that some days I was just stupid. And it wasn't until I embraced it and said, yeah, you're going to be dumb some days. And, but you can still lead with a smile. You can still lead with kindness and you can wait on people. You can do that. And you don't know where that drop of kindness is going to ripple out. But I firmly believe that if I'm nice to somebody, they're going to be nice to somebody else. And those ripples are going to spread. So on my good days and my bad days, that's what I'm embraced. Lead with love and lead with kindness. And then if you ask me, it's 2:16 in the afternoon, how am I? I'll say I woke up happy. It irritates my wife for one thing. But also that's become a habit. I wake up happy, and it's a good habit to have. So if you wake up looking for the good, as an entrepreneur on those tough days, if you wake up looking for good, the odds of you finding it are a lot more likely than if you wake up looking for a dog to kick, because you'll find somebody and piss them off, and that may be somebody that might help you later along your journey.
Mhm. Yeah. Um, yeah. So lead with love. That's a great,
Love and
I mean, that's a
kindness.
great principle, right?
Hmm.
Um, and you mentioned, stubbing your toe, maybe. What were, if you can share, maybe what were some failures that you really have learned from that help you to run the business you're running now?
Putting profit before principles, considering a doctor's W-2 as my report card rather than the broader context of a practice.
Mm.
That's in doing so, I wasn't true to myself. I was Charlemagne, Charlequin, Harlequin. I was one of those things.
Sure.
But yeah, all of those things.
One of the, oh yeah, sure.
And I have a show Saturday night if you'd like to come see it.
Yeah.
Um, I I forgot what got me to where I was. And it forced a hard reset because, for 30 years I was a grinder and I was considered myself indispensable to my flock, to my people, my patients, my doctors. And in doing so, um, I was good at what I did, but it made me a poor husband and father. So I'd forgotten the balance. And when I came into semi-retirement after long COVID, I thought my family would be there. Hey, come on, let's hang out, let's do stuff. But they were so used to me working all the time and always being on call that um, it was a rude awakening for me. But it was a really good awakening because it
Yeah.
helped me realign why I'm here and what's really important.
Hmm.
Nobody's gonna on my tombstone, um, nobody's gonna say he was a good administrator. That shit isn't gonna be on there. But are they gonna say he was a good husband and a good father and a good friend? I hope so. I hope
Yeah.
so. So it took me stubbing my toes to get to that point where um, I'm really clear-eyed about why I'm here and our purpose at Infusion Solutions.
Mm. That's good. And thank you for your candor about that. I mean, so
Mhm.
it really was that was a real turning point. The long COVID was the
Yeah,
time where
yeah,
it really knocked you off your feet and forced you to kind of consider things and reflect.
absolutely, absolutely. And in doing so, after I stopped resenting it and stopped being pissed at it,
Yeah. Yeah.
and and decided, it happened, and stop being mad. Make a difference. Get back to your roots of what makes me to quote Fiona Apple, a better version of me. And first person to ever quote Fiona Apple on one of your podcasts I can see. Um,
Explicitly anyway, yeah.
yeah, yeah. So it's I've become a better version of me. Am I perfect? Hell,
Yeah.
I'm learning, but that's also, I think that's an important part of the journey too of entrepreneurs is to um, never think you're the smartest person in the room. If you do, then you're probably the dumbest. And never think you got it figured out because the moment those words leave your lips, um, you're setting yourself up. Don't ever think that you have plateaued. So keep learning and keep open to learning from others.
Mhm. Yeah. Well, and I mean, that is what the podcast title is about. But first, principles. I think life has a tendency to do that, to just kind of force us to face things sometimes. And and if we're not going to resent it, if we're going to grow
Mhm.
from it, if we're going to
Yeah,
really learn from it, and if it's going to enrich our life, we have to go back to the foundations, go back to the simple stuff, like dough. Anyone could tell you like it's like, it's a Hallmark card or whatever, like lead with love. Yeah, that's cute, right? Well, I got to
Yeah.
make a buck, and I have 100 hours of work to do this week or, the next 2 days. Like, um, it's it's the simple stuff, but man, to really put into practice and to really live it out. I mean, that's the stuff of a good life. That's the stuff of a worthwhile
It
life that
is.
really makes a difference. Um,
And we're stronger when we look for the good.
mm,
You know,
yeah, absolutely.
it's there as an entrepreneur, there are 1,000 reasons to get discouraged and 1,000 reasons to take the off lane. But if you believe in your product, if you know the market and understand the product's niche and are willing to keep moving forward, um, that's the only way to give it a chance. There are too many folks that take the first or second or 50th off ramp, and most of the folks I know are not overnight successes. They are those who believed in what they were doing and stayed committed to it.
Yeah, absolutely. And we could keep talking. I do need, for the sake of time, need to wrap.
Yes,
But I do think that's a good place to end the conversation for now. Um, yeah, I mean that is a huge part of being an entrepreneur is finding the good, not resenting it, not looking for the easy out. You got to keep, like you can't harvest if you haven't gone through the paces of, plowing the field, planting the seed, weeding, watering, all those things, right? Um, so
very
business is the
true.
same. It takes time, and you got to be you have to have that belief, and you have to look for all the signs of life and all the signs of growth and all the signs of the harvest is
Yeah,
coming, right? Um, so
beautiful analogy.
I actually, yeah, I have to say, one of the men who's my hero, the heroes that I worked with, we helped to build a large organization. I was kind of his assistant, um, but he grew up on a farm and he used to talk about that all the time. That was the analogy he used all the time. So yeah. But anyway, Lucian, I really appreciate your time and being able to speak with you. And I'm curious, at this point, maybe just in a nutshell, again, just real briefly, what do you see for the future of Infusion Solutions? What do you want to see happen next few years, the next 50 years, or like what kind of vision do you have going forward?
We've got magic, and when you have magic, if you keep growing, you lose it. We have momentum, and
Hmm.
I have grown practices too large before in the sake of the almighty dollar and market monopolies, blah, blah, blah. Um, I don't want to make that mistake again. So we don't need to take care of the world. We just need to take care of our small piece of the world and continue to do that well. So expansions and things like that, um, they aren't in the near or long range view.
Hmm.
It's doing what we do and take care of folks and believing that that's enough.
That's awesome. Yeah, and organic growth. I mean, along the same lines, right?
Yeah, yeah, but also I don't want to go to Roanoke or Charlotte or other
Okay.
areas um,
Keep it small. You want
because
to
we've
purposefully keep
we've
it
got
small.
the magic, and that would detract from our mission, which is
Sure.
one happy patient at a time. We got it. We're going to keep working on that and improving it every day, and that makes me happy.
That's cool. Great. So if anybody wants to connect with you, how would they do that?
Well, I guess my email address is lroberts at the infusionsolution.com.
Got it.
And that'd be the
L
best way to get
Roberts
it. At,
at theinfusionsolution.com.
yes.
Beautiful. And I'll link that as much as I can with the way that the podcast works. I'll put a link to your email address, and if you don't mind,
No,
Um,
that's fine.
and who would you love to connect with? Who, if someone heard this, what's the kind of person you would hope would connect with you?
Well, I don't know, I'm pretty happy. You know,
Just people
it's,
who, yeah,
I met the bassist for the alternative band, The Hit and the Heart this morning. I'm riding off of that high. So,
nice.
you know, those are things like that. And you just meet people, if you lead with a smile and
Mhm.
a kind word and manners cannot be underrated. Um, the cool finds you. So happy to connect with anybody.
Excellent. Well, great. Well, once again, thanks a lot. I really appreciate sorry, the conversation, brief as it felt. Just I love what you're doing, and let's keep serving people.
Thank you. Thank you. This was fun. Have a swell day.